Good morning. Welcome, welcome, welcome. We are now in session 3 of the Roar Conference. I am so very pleased to welcome you all this morning to this great session being brought to us by our partner, Aeon. Today, we're going to talk about managing the cost of risk in health in a post-COVID environment. I hope all of you will take the time to listen carefully and closely as we have our team members from the Aeon family share with us important information around how we can get back to our next in a safe, healthy, and productive way. I'm very pleased that we continue this partnership with Aeon, and I thank them very much for taking the time out of their day. With that, I'm going to turn it over to Shelly Brown, who's going to lead you through today's presentation. Shelly?
Valerie, good morning, and thank you to you and the EMSDC team for helping us get a chance to share with the EMSDC community a little bit about our perspective on risk and health in the COVID environment. My name is Shelly Brown. I'm the Diversity Solutions Leader at Aeon. I am also pleased to share I am a proud board member of the EMSDC. So greetings to my fellow board members. And again, Valerie, thank you for your leadership and partnership here today. Pleased to present a robust slate of Aeon colleagues to share with you a little bit today about our comments. First off, I want to introduce is Dr. Neal Mills. He is the Chief Medical Officer for Aeon. You'll hear from Dr. Mills sharing a few things from his perspective about Aeon, what we are seeing around risk and health, and what we see in the marketplace broadly. May I ask, could you advance to the next slide? And we'll just do a quick review of the agenda here. Thank you. Dr. Mills is going to be joined by our colleague, Ashley Di Silvestrio. Ashley is going to also share a little bit about return to work, some things that we're seeing that's going on in the marketplace from employers at large. Following Ashley will be Carleen Coleman. She's going to talk to you a little bit about health, social determinants of health, inclusive benefits from a diversity perspective in the health discussion. Following Ashley is our colleague, Jeff Pope. Jeff is going to talk to you a little bit about business continuity, cyber risk and security. Then I'm going to be joined by our Aeon Philadelphia business leader, David Bennick, and we're going to talk to you a little bit about Aeon Diversity Solutions and a program that we're particularly proud of at Aeon, our apprenticeship program. We'll do a quick closing and then get you on to the 12 o'clock keynote speaker as a part of the Roar Conference agenda. But for now, I'm very pleased to introduce Dr. Neal Mills, again, the Chief Medical Officer for Aeon.
Thank you, Shelly. Good morning, everybody. What an immense privilege it is to be here today. Let's move on to the next slide. And we have a few slides that will give us a overview of what's happening in the COVID world. We'll talk a little bit about the COVID testing, a little bit about the OSHA guidelines that we believe will be out by mid-October, and the latest that we know about the vaccines. This information seems to be changing on an almost daily basis. So let's move on to the next slide and we will get started. Thank you. So here is the great news. The hospitalizations for the last week or so have been trending down, and it is believed that we have experienced the peak of this most recent surge that you can hear that really began back in late July with a peak that happened about 2 or 3 weeks ago. I'm sure all of you are aware and have seen the news that we've hit 675,000 deaths, which now is a greater number of deaths than what we saw during the Spanish flu. And so there are many indicators that show that we are headed in the right direction and that this peak has happened, in that we're seeing lower lab positivity rates. We're seeing a reduction from the peak deaths that also happened on this particular surge. So lots of good news. Let's move on to the next slide. This was an interesting published article that was reviewed by Bloomberg and shown here. The black line shows across the spectrum of time the number of hospitalizations per 100,000 people that are vaccinated. And what you can see here is that line has remained fairly stable. And what that means for us on the phone and for the employees and organizations that we serve is that vaccines remain a powerful way to dramatically reduce and avoid hospitalizations. But unfortunately, what we know is that this blue line represents the unvaccinated, and the unvaccinated are the most susceptible to developing COVID and then going on to develop severe COVID. And unfortunately, maybe even 1 or 2% going on to pass away. So those vaccines maintain strong immunity at 6 and 9 months. There is a concern around waning immunity. And as we see in the news almost on a daily basis, we're seeing the government and some of the academic bodies getting closer to recommending perhaps booster shots for more than those that are just perhaps immunocompromised, but maybe new indications, including, for example, maybe those over the age of 65. So there's no formal guidelines on which additional segments of the population are going to get these or recommended that they get them, but I think that's going to happen any day, maybe even as early as today. Let's go on to the next slide. So here is the interesting cost of the unvaccinated. And this is something that our COVID task force has helped many clients across many sectors of our economy. And I'll point out one of the most interesting that's not even on here, and that is we are helping organizations recognize the cost of permitting unvaccinated employees on their campus. OSHA may be coming out with guidelines in October that are indicating whether testing may be mandatory in those that aren't fully vaccinated. Now, those costs for those tests, if you were going to do that on a bi-weekly basis for a large segment of your population, could run into the millions of dollars. And so many employers are revisiting their decision to not mandate the vaccine simply because of the cost of the antigen test, which can run in the millions of dollars. But as you can see here, the average COVID-related hospitalization cost is $20,000. And it's estimated that our cost to society is $5.7 billion estimated preventable cost for unvaccinated COVID-related adult hospitalization. So that is a huge number. The bottom line, your takeaway today, is that if you were to have a fully vaccinated workforce, you're going to save money in terms of the antigen testing that you don't have to do, which may be mandated by OSHA in the near future, plus the medical claims cost, plus the ingredients inside of the COVID vaccine are actually no charge to you. Now, yes, you may wind up paying for that as an employer through the cost of the administration, but the vaccine is free and the average hospitalization, $20,000. So many employers are now revisiting this and they're eager to save money. They want to be competitive in the marketplace. And this is one place where employers can save money. So lots of employers looking at the entire continuum here, from surcharges all the way to incentives, providing paid time off, and then perhaps a policy where only vaccinated can show up at the work site. Let's move on to the next slide. Okay, so we talked a little bit about the OSHA developing COVID vaccine mandates. This has created an enormous surge for demand with finding out who those vendors are that can do the COVID testing at scale. And what I can tell you is that that has created a lot of pressure. So prices are going up for these antigen tests. And most vendors are saying you need to get in line. And the soonest, if you ask for it today and sign the contract, as soon as we can get you started, is going to be in November. So the sooner you get in line, the sooner you can get access to these tests for your unvaccinated. Now, it's also interesting because about 10% of the employers that we talk to are also interested in providing testing in the fully vaccinated. You'll recall that at the beginning of our conversation today, the fully vaccinated can go on to develop COVID and can transmit it. And that's because of this condition about the waning immunity. But most employers are not doing that today. And there's certainly not a lot of government guidance suggesting that that be done. And one of the things you'll need to look at are the expenses associated with that. That may not necessarily be something that's affordable to do on a long-term sustainable basis. Let's move on to the next slide. Okay, I am now going to hand things off to a far better speaker than I, Ashley. Thank you, Ashley.
Thank you so much for that, Dr. Mills. Really appreciated your update there on COVID-19. But now I wanted to get into a little bit, after we've had that update, what can employers be doing now? And Aeon tried to answer that question in a couple of different ways. What we saw early in the pandemic is that the solution can't just happen at the company level. So Aeon engaged about 100 different companies across the world, in 3 cities within the United States and another 7 cities internationally, to bring them together and discuss what was the best way to reopen together. And this included in the United States, Chicago, New York, and the city of Philadelphia. And we've also included a couple of the organizations that participated here on this slide. Next slide, please. Okay, and as part of those coalitions, we invited these organizations to complete the Aeon Resiliency Assessment. And this was a unique cross-organizational approach that covered 17 different areas, was over 100 questions. It was about half HR focused and about half risk management focused, because what we were really seeing is that organizations were cutting across the individual silos to bring everyone together to figure out what is the best way to reopen during or after the pandemic. And essentially what the assessment tried to do was dive in to their resiliency during this pandemic environment. And here's a little bit of what we found. There is no one size fits all for any organization or any industry. And as the parameters of the pandemic continue to change, forcing organizations to continually adapt, you really have to be flexible. We saw early in the pandemic, and has continued through today, as organizations really dealt with the threat within their geography. So there's been reopenings and there's been reclosings. Then there's a handful of reopenings and then maybe a smaller reclosing. So again, that real focus on agility and flexibility to deal with the threat within your specific geography. Early discussions revolved around the return to work. How do you open up a building that's been closed for several months? What's the best and safest way to do that? And then as the pandemic progressed, we started to see a greater investment into making things better for employees in this new, very much virtual environment. And then another area of concern that we started to see last year at this time and has continued through this year, I would say, is how can organizations deal with a virtual workforce during competing environmental catastrophes like wildfires and hurricanes, all while dealing with a pandemic. And again, there's no one size fits all, but this is what organizations were really thinking about and trying to commit to paper. What is the best way to think through this? And then the last area we saw repeatedly among these employers is the question of virtual work. It seems to work very well, but is it permanent? And is it right for my organization and its culture? Next slide, please. So then the question becomes, what happens now? So we know all this. It seems to be working, but is it right for me? So Aeon releases a pulse survey run by our human capital team, and I've pulled a couple of their most recent results here to give you an idea of where employers are seeing themselves right now in this environment. And what it really boils down to is that they're really starting to focus on the future of work. 69% of organizations have future of work task forces. The ones that I've been engaged with have very much been made up of different silos across the enterprises, HR, risk management, finance, a little bit of everything really brought to the table. However, very few, only 26%, have a clear idea of what this looks like for them. Next slide, please. So what does this future of work look like? We've seen on the slide before that it's still very nebulous, but what are employers thinking about? and 88 to 90% of respondents are focusing on three things: remote and flexible working, attracting and retaining talent, uh, and training. And very specifically, they're looking at DE&I. You can't just build back, you have to build back better. Additionally, there is a strong contingent of respondents who are really thinking through well-being. What does that look like in a virtual world? What does that look like now that my organization has some in the office, some elsewhere? And that's really been on their mind as well. And really what we're also seeing is that companies are looking at hybrid work arrangements. About 74% are looking at that hybrid and thinking that's probably the right way for them to go. Some in the office, some not in the office, employees choosing or employers mandating which days they need to go in, but really a split between returning and staying home. And yet again, only a third have really started an analysis around those specific roles. What can be remote, what can't be remote. And really only about a third of them have started a formal assessment to really look into what does that look like for me. So I'd say overall, we're still very early in this process. Next slide, please. Okay. So let's say you are interested in remote working for some of your employees or for all of your employees. How do you actually go about preparing for that? And based on what we've seen in the Pulse surveys and what we saw with the Work, Travel, and Convene coalitions, here's a couple of things and suggested actions that we recommend you take a look at. First being, identify roles that can be done flexibly, remotely, or are required to be on site. Really take a look at each individual role and decide whether that one can be done remotely or whether it really does need to be done in person. And then develop worker profiles that will succeed in those settings. Virtual work is very different than work on site. Really diving into that difference and making sure that you know what profile is going to fit that work environment will help you succeed in the future. And don't forget the managers. Working remotely is very different. It takes, there's definitely a learning curve behind it. So make sure that you remember to build and support your managers in that endeavor. And then last but not least, consider adjusting employee rewards to better reflect this change. Again, it's not a one size fits all, but it does need to be re-looked at to make sure that it still fits. Next slide, please. All right. And perhaps you're not only looking at remote working, but you're looking at workforce agility a little bit broader. How do you go about supporting an agile workforce? And again, based on our Pulse survey and our work with the coalition, we do have a couple of recommendations there as well. The first being re-examine career trajectories, including career mobility of workers in remote and hybrid working models. What does that look like? What will that look like in the future? Do we have the right support in place to manage both those who are in the office and those who are not, giving them an equal chance to succeed? The next would be to evaluate your policies and practices across your workforce to determine whether they're equitable. We truly recommend re-looking at that because your work environment has changed. Your policies and practices really do need to be updated to reflect that. And again, really take a look at that career development and growth opportunities specifically for remote workers. What should that look like? Maybe it should look just like the ones who are in the office, but maybe it should look really different. And again, it goes back to there is no one size fits all, but being able to do that deep dive and justify your decisions will really help you going forward. And then last but not least, craft a focused program to retain that talent once you identify it. And then really looking at your value proposition for essential workers and remote workers, just to make sure it's updated. Next slide. And actually, in the interest of time, we can skip to the next slide. Thanks. And I believe now both Neal and I are happy to take some questions if there's any.
Hey, thank you, Ashley. So next, let's pivot to Carlene. Carlene, if you could, can we advance the slide? I think we want to hear from Carlene Coleman. Excellent.
Thank
Thank you,
you.
Carlene.
Thank you, Shelly. Thank you. It's nice to be here. And I'm going to talk today about managing the cost of benefits through innovation. Next slide, please. So we'll talk about forces shaping the current state of healthcare, employer challenges, and employer responses. Next slide. So forces shaping healthcare current state for employers, doing business just got harder. Economic uncertainty, we're in a pandemic, and pressures on business revenues has caused employers to really have a challenge with doing business. Virtual working environment, and also a demand for diversity, equity, and inclusion. For employers and families, we're talking about new and existing challenges that are amplified, working parent strain, looking at mental and emotional health, financial concerns, productivity challenges, delayed and preventative care, and health disparities. And for the clinical ecosystem, primary care constraints, and the emerging vendor solution, more tools and resources come into the forefront, offering because of the demand for virtual care. For suppliers, again, emerging solutions, complexities of administration, doing business just got harder again because of the pandemic. We're mostly doing a lot of business virtually. Next slide. COVID has also impacted HR priorities, and the priorities have now shifted from battle for talent to resilience. So looking at this slide, you'll see that pre-COVID, most of the HR priorities focused on family-friendly benefits, new parent support, financial well-being, and voluntary benefits, benefits that employees could purchase and access through employers. Post-COVID, more of the HR priorities have now shifted to safety, essential workers, remote workers, well-being, work-life balance, and healthcare. So we'll talk a little bit about how we can help with innovative tools and resources to help with the shift in HR priorities. Next slide. Health topics due to COVID have shifted also, more so to identify cost savings through benefits, evaluating current carriers, evaluating current access to primary care, ensuring that employers are in compliance, most recently with the mandate on helping on employers needing to vaccinate or test employees if you have more than 100 employees, waiting for OSHA to release those guidelines. Support and engaging employees. How do we do that in a COVID environment? More so virtually, having to come up with some innovative resources and tools to help support and engage employees would include also looking at their mental health and well-being through the pandemic, and how EAP programs can help. How do we communicate with employees through the COVID crisis? More so virtually, coming up with innovative technologies so we can effectively engage and keep employees updated on what's happening with their benefits. Next slide. How has COVID impacted the market, and how has COVID impacted claims? So COVID has had an impact and inflators on claims relative to conditions. Some folks have neglected to manage their chronic conditions. Some folks have not gotten testing or treatment, and getting access to providers is now at a higher cost. Some of the suppressors for the health markets have been avoided claims where there have been some elective surgeries that have been postponed. Telemedicine, access in virtual healthcare, that has been a suppressor because access in healthcare through telemedicine is a little bit less expensive than actually going into a doctor's office. Next slide. COVID vaccines. Some employers have been offering incentives. You'll see that employers who will provide incentives for COVID vaccines, 3%, 10% are not interested, but they're actively considering it, and 26% are considering it, and 61% they're unsure. This could change, one, because again, Biden last week just announced the vaccination mandate, so more to come on vaccine incentives for employers. Next slide. Emotional health has had a big impact due to COVID. So what we have found is that through many sources, emotional health has been impacted, where 61% of folks have increased depression. 57% of parents say it's too hard to handle working and childcare at the same time. Some folks are drinking heavily. That's surged by at least 41%. Job loss in association with increased depression, anxiety, distress, low self-esteem has led to higher rates of substance abuse and suicide. And so emotional health has been a priority for many employers in coming up with some innovative ways to help their employees handle the impact of COVID and their emotional well-being. Next slide. So when we think about well-being, we also have to have a conversation on diversity, equity, and inclusion and why that matters. Focus on diversity, equity, and inclusion is shifting, and it's become a spotlight in health disparity. Minorities have a higher rate of high blood pressure and diabetes. They are less likely to have a primary care physician. Blacks and Hispanic adults report more difficulties accessing affordable care at locations they can actually afford. You'll see on this slide the percentage of difficulty for healthcare that can be afforded by Blacks is at 40%. You'll see Hispanics, it's difficult, and for white, it's at 30%. Percentage of difficulty with a location that is easy to access or get to for Blacks, that's at 24%, for Hispanics at 30%, and for whites, it's at 10%. So having the diversity, equity, and inclusion conversation about well-being and health is truly a priority for a lot of employers. Next slide. How are employers responding based on the information we just went through and how COVID has impacted healthcare? Next slide. Employers are responding by looking at trends in healthcare. So current environment, there's a focus on well-being, physical, emotional, social, financial, and work-life balance. Virtual care is also a priority, looking at how to access mental health providers and tools. Looking also at narrow networks, second opinion programs, enhanced customer service and navigation tools for employees to understand how they can get access to providers and emotional health tools and resources. And also looking at on-site clinics and Walgreens, CVS has had an incentive in neighborhoods to have on-site clinics where folks can access care and quickly. Emerging trends based on what we just talked about with current environment is reimagining EAP, looking at programs where employees understand that EAP is not negative. It's actually helping a lot of folks with emotional well-being, including family members. Assistance with student loans, that's helping financial impact. Many employers are looking at even partially funding some programs to help employees with their student loans. Holistic well-being programs is also an emerging trend. Digital health technologies, custom networks, high-performance networks where we're looking at providers where we can give you actually how they're performing when it comes to taking care of their patients. Leading edge, adaptive benefits to support dynamic workforce, holistic total rewards, emotional well-being, again, very high priority. Flexible spending accounts, life savings account, and emerging plan concepts, getting employees access to primary care physicians. Next slide. Due to the pandemic, employers are looking at innovative ways to have employees access care. And one high priority is virtual care. Telemedicine, that's here to stay. So when we look at virtual care, we look at anticipating the expansion for access in virtual care to support emotional well-being, diabetes care management, health and lifestyle coaching, prenatal care, musculoskeletal management, and physical therapy. So again, looking at what the employer approach is relative to telehealth cost, you see that some employers have waived cost of telehealth due to the pandemic. Some employees had access to telehealth with no cost, and some employees have reduced cost because of the pandemic. Next slide. Focus again is on mental health as a priority, addressing increases in suicide and depression and anxiety. So getting employees the tools and resources to deal with emotional health when it comes to substance abuse and chemical use. Social isolation, being in the house all alone during the pandemic has been very difficult for a lot of employees to deal with. Social media and psychological impacts and effects it has on employees. Caregiving support, having support for employees who need help with childcare and parental care. Looking at also providing some tools and resources to employees that have been impacted by COVID deaths, and also giving employees access to grief and loss counseling. Technology to access behavioral health vendors, accessing it again, as we talked about on our prior slide, through virtual healthcare, telemedicine. Mental health and provider shortage, that's been a focus in trying to see how we can get additional providers in the health industry to help members with their mental health and well-being. And then holistic therapies have also been a high focus for employers to get access, to give access to their employees. Next slide. So as I mentioned before, addressing diversity, equity, and inclusion has really become a priority for many employers through the lens of social determinants for health and well-being. When we think about this, we look at where people are born, live, learn, work, play, worship, and age, and their age, the effect and wide range of health, function, and quality of life outcomes and risk. How do we help folks get access to health and well-being at an affordable cost? And how do we help get them access to providers and tools and resources that they can actually utilize? So that again is a priority for many employers, and a part of it again is social determinants. Next slide. So where do we start? We got to start somewhere. We have to start somewhere. We start by identifying the needs, connecting employees to resources, and filling the gaps with benefits. So again, identifying needs, use of public available data such as social determinants such as Centers for Disease Control, Prevention, Kaiser Family Foundation. Aeon has surveys that we also provide. It's on our website. Leveraging health plans to actually provide social determinants of health analytics. And that's something that is available, again, through your broker. Additional questions about social needs and health assessments. How can we help employees understand specifically their health and current state? How do we communicate that? How do we connect employees to resources? How do we leverage EAPs, advocacy programs that will help them navigate and gain access to tools and resources? How do we leverage public available lists of social services, again, to give employees access to low-cost programs and services? This is where we start. Again, identify a need, connecting employees to resources and filling the gaps. Implement and redesign your benefit programs. Address 6 key areas to focus on: income, access to healthcare, transportation, food access, childcare, and housing instability. Next slide, please. So again, innovative ideas that lead to a change in workforce. Think about remote working, family support, and financial well-being. So enhancing work from home well-being with items such as free digital workout programs like iFit. Develop a strategy to innovate virtual solutions to engage and communicate easy ways to use apps and tools and resources. Flexible work hours have been really engaging for employees. Childcare providers for in-home services while employees are working remotely. Giving family support is also an innovative idea and an option. College planning and counseling services, providing access to on-demand access to health advocates, not only for your employees, but also for members of their family. Early childhood learning tools. I can tell you that we most recently found out that Expedia told their staff members in September that its travel reimbursement policy is going to be a perk, and there's going to be a range in value from $250 to $750 depending on employee service. So again, there's certain ways to provide family support when it comes to employees and their well-being. Financial well-being, allow employees to replace existing student loans. We spoke about that earlier. Offer full-time employees $100 a month towards paying down their principal balance of their student loans. Employees can also convert unused paid time off. Online discounts and marketing places, access to that platform would be easier to go through when it's an employer, when it's presented with the employer benefits package. And confidential online personal finance programs that are designed to help with budgeting and provide step-by-step plans, video lessons, and budgeting tools. So again, innovative ideas to consider for a change in workforce: remote working, family support, and financial well-being are some options. Next slide. How can Aeon help? Next slide. We do offer a lot of innovative resources, tools, and we would partner with you to help with your strategy. When it comes to deep resources, strategy and design, vendor selection, compliance and regulatory support, employee communication, and financial resources. Next slide. So again, we do offer innovative tools and resources to help support you based on all the innovative resources and options I just discussed in managing the cost of benefits. We can help you control costs, mitigate risk, attract and retain talent, and reduce administrative burden. Next slide. Any questions before I introduce Jeff for cyber insurance? All right, Jeff.
Awesome. Thank you, Carlene. How's everybody doing this morning? Looking forward to doing a brief overview of cyber insurance, kind of what is entailed in the cyber policy, and of course, market trends and what to look for moving forward. Next slide, please. Thank you. So the evolving cyber threat, the evolving cyber market. I think when we talk about cyber risk in general, we inevitably have to talk about technology and how that has completely changed the landscape, right? So economic drivers, right? Automation is a significant economic driver. It's changed not only the job market, but it continues to increase the probability of a cyber claim or incident. Connectivity. We are more connected now in the business community than we ever have been. I think that will continue as we move forward. And last but not least, economic driver that is not mentioned here is intellectual property, somewhat of a byproduct of both automation and connectivity. Over the past 4 decades or so, we've seen a dramatic shift from tangible assets, physical assets, to intangible assets. And I think that continues to increase the probability for a cyber threat or incident. What are some of those technology drivers? We have big data, of course. We have artificial intelligence, social media, mobility, IoT, Internet of Things. Those drivers will continue. And then as a result of those economic drivers combined with the technology drivers, what are some of those strategic threats? There's 3 main strategic threats. You have disruption risk, confidential risk, and supplier risk. I'll spend a little time talking about disruption risk. So disruption risk, you obviously can have your production disrupted, your sales, your critical infrastructure. And last but not least, what might be most important is your distribution and supply chain. If your distribution or supply chain is impacted, it not only impacts you, but it impacts your partners, right? Your clients, your consumers, your other commercial partners. This can obviously balloon and lead to a massive cyber risk or threat. When we talk about confidential risk, you'll see a lot of letters here. I'll break them down quickly. PII, which is personal identifiable information. That definition has been broadened over the past decade or so. It used to just be social security numbers. Now it's everything from name, phone numbers, address. So that's something to pay attention to. PCI, which stands for payment card industry, credit card regulations, basically. PHI, which is personal health information, a subset of HIPAA. Just so you know, if you have a claim and it's HIPAA related, that claim is going to be much more expensive due to the medical information that is released, as opposed to a traditional cyber claim. Internal protocol, and last but not least, regulations. We've seen a number of regulatory bodies step up and really increase their regulations as an attempt to really get a hold of cyber claims and personal data that might be breached. And last but not least, supplier risk. There is the risk of property damage, bodily injury, or product liability. Next slide, please. Thank you. Ransomware loss trends are expected to continue through 2021. And real briefly, ransomware is a term that is thrown out there often. I think it's important to just define it quickly. And ransomware is a type of software designed to block access to a computer system and threatens to release personal data, obviously, until a sum of money, a ransom, is paid. Believe it or not, these claims are on the rise. When we talk about claims in general, we usually talk about claim frequency versus claim severity. I think most underwriters would argue that they would prefer to have a severe claim as opposed to frequency. It's much easier for Aeon or whoever your partner is to explain that to the market as a shot claim. It doesn't happen often. It won't happen again, as opposed to frequency, something that happens Obviously, let's say a minor issue every month. It's really hard to explain that, and it takes a lot to address that, right? So when we talk about claim frequency, our cyber solutions team, which is our dedicated team focused fully on cyber risk, saw a typical cadence of 3 errors and omissions cyber incidents or matters per business day in 2020. That's obviously significant, and it's up roughly 100% from 2019. Again, major ransomware events there. When we talk about claim severity, right? The average severity claim climbed each quarter last year in 2020. In many instances, claims experienced some 8-figure ransomware event-related losses. These are obviously significant claims. Just imagine suffering one of these claims and not having insurance in place. Pricing, right? Very interesting. And this is something we'll revisit over the next few slides. But we've seen on average from 2019 to 2020, pricing in cyber policies go up roughly 5 to 10%. That's interesting because that does not factor in the claim severity and frequency that we just discussed. And again, we'll revisit that in a little bit. And risk selection, because you've seen such an uptick in trends in not only claim frequency, but claim severity, specifically for ransomware, insurance carriers are spending much more time in due diligence on how they select risks, not only through the application process, but just the internal protocols and expertise of said organization, which I think is important, particularly for SMEs and middle markets. And at the bottom, you can see in a survey of the top 12 E&O cyber insurers that we work with, roughly 58% suggested that they will seek a rate increase of at least 30% through Q2 in 2021. So obviously the pricing hasn't caught up to that, but that is something that insurers are dealing with, insureds, organizations, companies are dealing with in real time, and we foresee that to continue in the near future. Next slide, please. So coverage overview. I think it's important to break down from a high level what's covered in an cyber insurance policy. Next slide, please. Thank you. So prevention, right? I think this is extremely important and not enough organizations focus on it. And cyber policy has evolved, let's say over the past 10 to 15 years. It used to be a risk that, it was extremely costly. The coverage wasn't great. The terms and conditions weren't great. I think that's changed. You see a lot more players in the space, a lot more emphasis on what are you doing to reduce the probability of a claim, right? And a big part of that is pre-breach assessments. Here at Aeon, we have several assessments that we can take our clients through. The carriers have several tools that they can use as well. Another one is access to pre-vetted vendors. A lot of people don't focus on this, but this can be a very expensive and time-consuming process. Several factors to consider here, right? When you're looking at vendors: cloud service configuration, application security, incident response, encryption. These are some of the factors that must be considered when you're looking at vendors, and the ability to have a list of pre-vetted vendors is pivotal and obviously very important. And last but not least, cyber security information. Moving on to assistance. What is covered in a cyber policy? I think this is extremely important. It's also important to note that every cyber policy for every carrier is different. It's important to have a partner like Aeon who can walk you through that process. But forensic investigations, regulators regionally and internationally require you to do some type of forensic investigation to fully understand how you were breached, when you were breached, where you were breached, and also potentially how many records were breached, right? This is extremely important, and this can be extremely costly if you don't have a cyber policy prepared to respond. There's obviously associated legal costs that come with a potential breach. The notifications, this is extremely important and can be time consuming and expensive. A good cyber policy responds and helps you in this manner. You have to notify everybody in your network. All your clients, your personal, commercial clients, your vendors, your partners, everybody has to be notified. Credit monitoring, extremely important. Call center services. And one that we don't touch on a lot is the potential for reputational damage. Having a firm, a crisis management firm, and those resources and public relations is extremely important. The blogs, the internet, Twitter, newspaper clippings, they might paint you in a bad light. What are you doing to kind of turn that ship around, so to speak, and the ability to have a crisis management, those resources, public relation firm to help you right the ship is extremely important. Moving on to operations, right? There's going to be several costs incurred with keeping or returning to your business status prior to the breach. Obviously, a loss of revenue and income will be inevitable there. And then last but not least, there's likely a cost that will be incurred to recreate or restore your data and information to, again, what it was prior to the breach. And liability, the legal costs and the damages associated with the potential breach from, again, those potential partners, your clients, your vendors. Extremely important here and something that a good cyber policy will respond to. Next slide, please. So I'm going to spend a little bit of time here specifically talking about the market standards for cyber coverages. There's two main risks that we'll look at here. One is operational risk, which again is essentially the uncertainties that a company will face in the course of conducting its daily business operations, its activities, its procedures, and its systems. You can see to the right, we have an overview, and I'll touch on a couple of them on the next couple slides, but briefly, network business interruption, system failure, dependent business interruption, which is slightly different than network business interruption, cyber extortion, and digital asset restoration. The next risk when we talk about market standards is privacy and network security liability. Extremely important here. And this really has to do with defense costs from the potential loss, right? And some of the overview factors here is, again, the security liability, the fines and potential penalties, media liability, PCI credit fines and penalties, and last but not least, breach event expenses. Next slide, please. So operational risk, right? This impacts the daily activities of your business. I won't spend too much time here, but network business interruption, essentially is a coverage that is built to reimburse coverage for lost income caused by not only the network system failure at hand, but the networks in general, right? And so retention, similar to deductible, and the waiting period here, the amount of time you have to wait before you can put the claim in is extremely important, but it's also negotiable. The system failure, kind of going back to the business interruption, this includes all your systems, not just the one that was compromised. And I know we spent a little time talking about dependent business interruption. This essentially has to do with the loss of income from a business interruption or system failure caused by a network security failure of a business in which you are dependent. So essentially a third party here. Much of this risk, I think it's important to note, can be transferred contractually. Not just cyber risk, but really any risk that you can transfer contractually and push that insurance on to somebody else, we think is extremely important. And that can be the difference of a massive claim. I'm going to skip these last few in the essence of time. Can we go to the next slide? Thank you. Privacy and network security risk, right? So privacy liability, security liability, again, this has to do with defense costs. Privacy liability covers defense costs and damages suffered by others for failure to protect, again, that PII, personal identifiable information, or confidential third-party corporate information. Security liability, a little bit different, covers defense costs and damages suffered by others as a result of a failure of your computer security. And then a few others that are important to mention. I'll skip security liability, but privacy, regulatory fines, and penalties. Many people don't talk about it, but as the regulators have kind of beefed up their regulations, there's always a risk of governmental agencies, fines and penalties that they might levy on your business depending on the breach for failure to protect client, consumer, private information. These fines and penalties can be costly. A good cyber policy will respond here. And last but not least, one I do want to mention, two more. Media liability. This happens to do with content-based injuries, right? Such as libel, slander, defamation, misinformation, copyright infringement, or invasion of privacy. This actually happens a lot. A lot of people don't talk about it. And then last but not least, breach event expenses, right? We talked about reputational damage. and how that can be a big blow to the business. And this is built to cover, those forensic investigation expenses, those legal expenses, consumer notifications, costs for public relation firm, crisis management, call centers, those sort of expenses that nobody really talks about, but become inevitable and really become a big deal in the event of a breach. Next slide, please. Thank you. So we talked about what is covered. I think it's just as important to talk about what is not covered. Obviously, every policy has exclusions. These are some of the major exclusions you'll find in most cyber policies. The first is obvious: deliberate acts. If you're dishonest, your fraudulent, criminal, or malicious acts, errors, omissions, or willful violations of law, obviously is not covered. Bodily injury, property damage, emotional distress, mental anguish, those type of things are not covered in a cyber policy. Antitrust, of course, not covered. Patents, trade secrets, war, infrastructural failure, those type of items are not covered in a policy. Those are some of the bigger items. There will be more exclusions, but these are some of the major ones. Next slide, please. Almost wrapping up here. We're going to just cover the market and give a quick update. Next slide, please. So we kind of talked about how the insurance market has evolved over time. In 2021, you'll continue to see some of the bigger names that most of us are familiar with in the space offering coverage. Again, I think it's important to note that every insurance carrier is going to offer different coverage, the sublimits, the terms and conditions. It's extremely important that you have a broker like Aeon or a partner who can walk you through the nuances and differences of each policy. But again, some of the big names will continue to be in the space: AIG, Hartford, Hiscox, Travelers, Berkshire, Beasley, you name it, right? Depending on the industry, depending on the growth, depending on the complexities of the risk, often we'll have to go to different markets to get certain limits or build a tower, so to speak. And we do have access, of course, to London and the Bermuda markets, particularly specifically for excess only. Next slide, please. Thank you. And last but not least, what are the market trends as of Q2 2021 for E&O cyber insurance? This might as well be labeled another ransomware slide. When we talk about claims and losses, there's been some extremely complex cyber losses that have impacted the market. They've had really a negative impact on the market. Much of that has to do with ransomware claims, specifically for SMEs and middle market organizations. Unfortunately, SMEs and middle market organizations are slow to acquire and obtain cyber insurance, unlike larger organizations. And that's where we're seeing a lot of the claims activity. So when we have these conversations, we stress the importance of getting it. Again, as opposed to maybe 10 or 15 years ago, the premiums prior to a breach, I think are relatively inexpensive. Again, factoring in your revenue, your access to data, how much records you might be holding in your industry. Coverage, right? We've seen an impact on coverage, again, specifically because of ransomware events. Certain insurers are also starting to retract coverage specifically for IT supply chain related events, right? So if you are contracted using a third party for your IT, that might be an opportunity to contractually transfer that risk. But carriers are responding specifically to the ransomware events that have happened as of late. Capacity issues, right? Carriers are taking a much harder look at the capacity that they deploy specifically for cyber risk, not only in SMEs, but also the middle market as well. You're starting to see insurers require more retention, a higher deductible upfront. So if you had a policy or a program where you had, let's say, a $25,000 deductible, they might be requesting a $50,000 deductible and even a uptick in premium. I think that's important to take a look at. And then last but not least, the rate environment. We talked about it. When we talk to insurers, particularly the bigger insurers that we work with, they fully anticipate, the need for a 30 to 50% increase, specifically for large enterprise organizations and companies. And for SMEs and middle market, they fully expect an increase of at least 30% in these policies, right? And so, cyber claims can explode to 7 or 8 figure, costs in total claim damages, right? And so We always say, listen, let's be proactive. Let's talk about the risk. These are some of the market trends that we believe will continue not only through Q3 and Q4, but throughout 2022. That concludes my piece. I'll turn it over to Shelly Brown and David Bennett. Thank you.
Okay, so David, man, we just heard a lot of powerful content. Working backwards here, Jeff hit on some things that really resonated with me. It's not the size of the business that needs a cyber concern. All businesses need a cyber concern. Before that, Carlene talking about, just health, access to healthcare, being mindful of how not only physically we're doing, but our mental health. Before that, Ashley talking about return to office, things that employers are thinking about. And then at the top of the agenda, our Chief Medical Officer, Dr. Mills, bringing some heavy data. Sounds like we're making a positive trend. Let's hope that sustains. David, tell me what you thought about so far today.
Shelly, thank you so much. And first of all, hey, thank you to everybody for attending and investing your time in the session this morning. Shelly, I think you said it very well and summed it up extremely well. When we were talking to Valerie earlier on about, what would be of most interest to the EMSDC members, really where we wanted to take the discussion is, what are the issues that are facing EMSDC members today? How do you thrive in a post-COVID environment? And after some discussion internally, as Shelly summarized, we really thought these were the three that would be top of mind for the EMSDC. How do you manage? How do you return your work? How do you bring your folks back post-COVID? How do you manage healthcare costs, which is probably one of the biggest cost drivers for many small businesses? And then lastly, Jeff's presentation on cyber, which is fantastic, which, not a day goes by where you don't open the paper and you see a ransomware attack. And I think the point of all that, Shelly, is just that, we as Aeon, we're just interested in partnering with our colleagues and providing the content, resources, and consultative guidance to assist all of our clients with whatever they need to help operate their business more effectively. So I just want to thank the folks for attending the session today. Great big thank you to Valerie Cofield and her team at EMSDC for the great work that you are doing and the great work that EMSDC is doing. And we at Aeon, and Shelly touched on this, we're just thrilled to be a part of EMSDC. We're thrilled to have Shelly volunteer his time to serve on the board, and we're thrilled to be a financial supporter of the great work that EMSDC is doing in our community, both Southern New Jersey, Delaware, Eastern Pennsylvania, and Western Pennsylvania. We're thrilled to partner with each one of them. And just a little bit of Aeon, a little bit of background on Aeon, just so you may be familiar with us or may not. In the Philadelphia area, we have over 1,000 employees working alongside our clients every day, helping them manage their business and all different aspects of their business. And of those 1,000 employees, we're making a very strong and visible commitment to our inclusion and diversity initiative. And EMSDC is one leg of that initiative. Another one, we have a strong relationship with Lincoln University, sponsoring Lincoln and helping them as a HBCU to provide guidance to them and hire their graduates. And then thirdly, one of the other initiatives that we've taken on here in the last year or so, which you may be familiar with, is Aeon's apprenticeship program. It's just an exciting program. Our CEO announced this about a year or so ago. Aeon is investing $30 million and hiring over 10,000 apprentices as a reflection of our commitment to helping grow our inclusion and diversity, invest in our inclusion and diversity, and make sure that our workforce is representative of society at large. And we lobbied hard, and we're thrilled that Philadelphia was selected to be one of the cities around the world where we can launch Aeon's apprenticeship program. We've hired over 20 apprentices locally in the last 30 days, and just so exciting to see those folks contribute to our office. And as we always say, we will learn as much from them as they will learn from us as part of their apprenticeship program. So just thrilled to have that opportunity to invest in our community and thrilled to have the opportunity to attract top talent to our firm so that we can continue to provide consultative services to our clients. So, Shelly, let me turn it back over to you. I think I certainly think the folks on the line would be very interested in hearing some of the things that you're doing as our champion of the Aeon Diversity Solutions program.
Well, first off, again, David, thanks for making this a priority. We need visible vocal leadership always, but visible vocal leadership sets the tone and priority around inclusive leadership. So thank you. It's been a great journey to partner with you. And then, I'm really pleased to share across the EMSDC footprint. Aeon is represented also over in Pittsburgh. Our business leader there is Sherry Grassick. We're going to share her contact information as well. Love to make some connections for the EMSDC stakeholders who are in Western PA. Just thinking a little bit out loud about Aeon and our commitment to inclusive leadership. I'm going to share just a couple of slides here. If we could advance the slide, that would be great. Here's a couple of things that we focus on around what we do with respect to our value creation. Our strategy goes end to end where we work with leading commercial stakeholders. So our chief commercial officer, our stakeholders who look after our largest global clients at the enterprise client level, to our colleagues in every segment of our lines of business. We're thinking about how Aeon can show up differently on our client solutions. When we think about the work of our chief procurement officer and his team of category managers who look after Aeon procurement, we show up there as well. We have also a leading prime supplier program or our tier 2 program where we're asking our top 100 US suppliers join along with us. And I'm pleased to see in the room today, not only fellow board members who are also clients, but just many fantastic certified MBEs. So if you're looking to confirm that Aeon is open for business, please take this experience as a confirmation of that investment. Next slide, please. We also took an opportunity to look at what's the business case for economic inclusion within the firm, because we think this strategy can never be overtold or overstated. So number one, we know that our clients are asking us to show up differently with diversity partnerships. We certainly know through the journey of 2020 around calls for change, racial equality, social justice. So many business leaders, including our own CEO, Greg Case, said, hey, we're going to think differently about diversity. We're going to think differently about our culture inside our firm. So whether it's the work of Aeon Diversity Solutions or maybe through the work of our apprenticeship program, we're going to show up differently. When you look at economic inclusion, we know that it accelerates the economic cycle. Number two, when we all get involved, we all grow and develop. And then number three, it enhances our performance. So we're looking for new ways to grow relationships. So as Aeon continues to grow within the commercial space, where Aeon continues to make investments for growth in the public sector, but then also where Aeon is looking to grow and develop its solutions. You saw in Carlene's presentation our Aeon Local Advantage strategy, which is a tailored, targeted approach to support small business. Next slide, please. Again, I want to make certain that we know how to convey our message. So this is a slide that represents kind of Aeon enterprise-wide. And here are instances where we have brought to market diversity partnerships on our client projects. You see the list is pretty robust. It's a sample of some of the things we do. But if you find your businesses in this space represented on the slide, we'd love to have a conversation as we look to develop new diversity partnerships within our firm. Next slide, please. Lastly, I want to make certain we know how to stay connected. So between myself, David, Sherry, and Pittsburgh, here's our contact information. I love to stay in contact via email. To me, email is that's a job order, or it's your receipt that we had an exchange, that we made a commitment to stay connected with each other. Please take full advantage of that. I'd also encourage you to check out our external website, aeon.com/connect. aeon.com/diversity solutions. You'll see it's a fairly short walk between our CEO, our Chief Procurement Officer, and my desk. We liaise closely. We've harmonized our strategy around our Aeon Global Supplier Diversity Commitment Statement, which was co-signed last year by both our CEO and our Chief Procurement Officer. We have out on our website an economic impact report, which we post every 3 years, which gives a good trend analysis of what kinds of things we're doing in the marketplace. I'm pleased to share, when it was published in March of 20, we did a nice feature of our partnership with Valerie Cofield and the EMSDC. So check it out. It's a downloadable resource for you. Lastly, I just want to come back and underscore my appreciation and the privilege to represent my firm on the board of EMSDC. Again, to fellow board members, thank you. Really appreciate you making time to join us here today. To the certified MBEs, love to find ways where we can stay connected from today's discussion. But lastly, I want to just underscore the apprenticeship program. The apprenticeship program is so powerful and unique to Aeon. We all know that education is the silver bullet. It can change your life and your life trajectory. We also know that it's a fantastic opportunity to underscore social mobility. When I look personally at my experience in the apprenticeship program, it's richly rewarding. Last year, I brought on 2 colleagues to the Aeon Diversity Solutions team via the apprenticeship program. Both of them are very powerful contributors. Both of them have also expressed a desire to grow. The thing that I'm most impressed about is Aeon bringing social mobility into a professional services firm, right? So the program, quickly, you earn while you learn. So in school, 12 hours a week, at the Aeon desk, 28 hours a week. There are performance goals on both the academic standard as well as in the performance goal. At the end of the 2-year period, as these colleagues complete and pursue their associate's degree, if they are achieving both of those goals, Aeon writes a check and pays for their associate's degree and offers them a job full-time. Coming on board full-time also gives them access to the tuition reimbursement program as they pursue their bachelor's degree. So the reason I'm sharing, I think it's a fantastic opportunity. David would be more than happy to have conversations with EMSDC corporate members about the benefit of this program. We're looking to establish a cohort of employers who would be willing to come along in this journey with us as we grow our community, one student, one employee, one colleague at a time. Lastly, I just think it's a fantastic opportunity to show up a little differently as we all grow and bring better to each other. So thank you so much for the chance to share personally about the apprenticeship program. Lastly, and I'll close here. Thank you to my colleagues for joining in today's presentation. Fantastic content. You all did wonderfully. For those who are participating in the ROAR conference, please stay tuned for the keynote speaker presentation at the top of the hour, right back here on the ROAR conference platform. Valerie, I'm going to turn it back over to you. Thank you again so much. We really appreciate the chance to be a part of this journey today and continuing our journey in the EMSDC community.
Well, thank you, Shelly, and thank you to Team Aeon. I want to thank everyone. David, Carlene, I want to thank Jeff, I want to thank Ashley, and I want to thank Dr. Mills for taking time today with us to share, a wealth of information. For those who don't know, all of the content from today's ROAR sessions will be available on EMSDC's YouTube page, on our website, and it will be shared with every conference registrant. So we will make sure that this information is shared broadly, and is delivered, because I was captivated on so many different touch points that resonated with me as a leader here at EMSDC, but more importantly is how I could support and help my MBEs and even some of the discussions that I've had with my corporate partners. And so as we look at sessions like these, we have to remember that it is helping us forge our path forward. So thank you again to Shelly and the entire Aeon team. I have enjoyed today's information session. As Shelly said, I invite everyone to join us back here at the top of the hour for our keynote presentation from Luann Khan. Thank you, everyone. Take a few minutes, stand up, move around, because that's a part of health, is making sure that we are moving. Get up, move around, but join us back here at the top of the hour at 12 o'clock to hear from Luann Khan. Thank you very much. Be well.